Let's go.
Hi everyone, we're Team 6. My name is Lon, and my teammates Stephanie and Michelle will be telling you about New Zealand's healthcare system. First, we'll start out with some basic New Zealand facts. So New Zealand is located in the southwest Pacific Ocean, and it's made up of 3 main islands. You can see right here the North and the South Island, but there's also Stewart Island. In total, there are 4.5 million residents. Citizenship is granted by birth, grant, and descent, making residents known as Kiwis, which is also the state bird that you can see in the bottom right-hand corner. New Zealand is well known for their scenery, wine, culture, and of course, they are home of the filming grounds for the Lord of the Rings trilogy, which you can see in the top right-hand corner. Almost 1/3 of the country is made up of marine and wildlife reserves, as well as protected parkland, making it a popular travel destination. New Zealand's government structure is similar to that of the United States. New Zealand's government is ceremonially referred to as Her Majesty's Government in New Zealand. They have used to be a responsible government in which there's a parliamentary accountability. That's why they have a judiciary branch, an executive branch, and legislative branch, similar to the United States, to create a checks and balances of power. The government operates with the overarching theme that the Queen reigns, but the government rules, as long as it has support of the House of Representatives. There's an executive council where ministers are sworn in. A handful of these ministers make up the cabinet, which is led by the Prime Minister. The Prime Minister commands the support of a majority of the members in the House of Representatives. The Prime Minister and other ministers are formally appointed by the Governor General. Right now, the Governor General is Dame Patsy Reddy, and the head of state is the Sovereign Queen Elizabeth II, who you see pictured here. So overall, New Zealand's healthcare has been working towards a national health system since the Social Security Act of 1938, which was in response to the Great Depression in the 1930s. This was put into place to protect their citizens against circumstances such as unemployment. The Social Security Act was the cornerstone that introduced free at the point of use healthcare. Since the Social Security Act of 1938, the overall view of healthcare in New Zealand is that it should be universal, free from financial barriers, fair in standards of treatment, and concentrated on integration and prevention rather than curative in focus. Enactment of this legislation enabled universal entitlement to a tax-funded and comprehensive healthcare system. Next up, Michelle is going to be telling us about the history of healthcare.
The history of New Zealand's healthcare. Between 1938 and 1983, New Zealand's health system developed a dual system of public and private provision, part of the Social Security Act of 1938. 1983 to 1993, the gradual establishment of 14 area health boards, the AHB, funded by population-based formula, part of the Area Health Board Act of 1983. In 1993, 4 regional health authorities, RHAs, were established. Purchasing and provision of health services were separated. The 14 area health boards were reconfigured into 23 Crown Health Enterprises, the CFHEs, structured as for-profit organizations and subject to ordinary company law. Public health services were unbundled and a separate public health purchasing agency, the Public Health Commission, was established as part of the Health and Disability Service Act of 1993. In 1997, the National New Zealand First Coalition government, through the Coalition Agreement of Health, reformed the structure of the health system. In 1998, 4 RHAs were combined into one national purchasing agency, the Health Funding Authority, HFH. The 23 CHEs were reconfigured as 24 not-for-profit, Crown-owned companies and renamed Hospital and Health Services, the HHS. In the year 2000, the Labor Alliance Coalition government initiated a health system reform, which included in 2001, 21 district health boards, DHBs, were formed. Primary health organizations, PHOs, were developed in 2002 to manage primary care, including general practitioners and their services. New Zealand's Health and Disability Act of 2000. The most recent healthcare system reform in New Zealand took place in 2000. In addition to the HFS went away, as well as the HHS, which were replaced by 20 district health boards. Today, these DHBs are comprised of 7 local members and up to 4 members whom are appointed by the MOH. These boards pursue government objectives, targets, and services requirements while operating government-owned hospitals and health centers, providing community services and purchasing services for non-government and private providers. Here, this is how the current New Zealand's healthcare center flows. Shown is the hierarchy of how the system flows and who reports to whom. As you can see on this graph here, the Minister of Health are the top notch. They receive advice from core committees, funding from other organizations, all report up to the MOH to create New Zealand's healthcare system. Now we will have Stephanie, who will speak on New Zealand's current healthcare system.
Thank you. New Zealand follows the Beveridge model, which is healthcare for all citizens for free or reduced cost to consumers. Healthcare is funded by the government by using taxes raised to pay for the majority of the costs. New Zealand consumers are expected to see their general practitioner as their first line for non-urgent and chronic care. The public system in New Zealand is free, but consumers also have the choice to purchase private healthcare where consumers pay out of pocket for additional services. Private options help to cover cost-sharing requirements, elective surgery, private specialists, and faster treatment options. New Zealand healthcare system is similar to the US and Canada. They were able to combine the best parts of several systems to provide the best care for consumers while also holding down costs. One issue they will need to face head-on is the aging population and expected longevity. As consumers age, there's a possibility of higher costs of care. The healthcare system works similar to other models studied. The general practitioner is the first physician to see consumers see for most conditions. Specialists are consulted as needed, and urgent care can still be sought in the emergency room if needed. Children and the elderly receive some additional benefits, though the elderly are expected to cover part of the cost. Dental care is not covered, so consumers are expected to pay fees for service. Up next, Land will provide some insight into the issues affecting New Zealand.
So New Zealand faces similar problems with their healthcare system as many other countries face, such as aging population and rising costs. The average life expectancy in New Zealand is 80.6 years per person. It's specifically 82.7 years for women and 78.6 years for men. This is obviously a great benefit for individuals and families. However, it's raised concerns in the amount of spending for the care of the elderly. Also in New Zealand, some of the top issues are heart disease, diabetes, depression, and dementia. Many of these issues are not detected until later in life and must be maintained once they're diagnosed. New Zealand has a mindset of living a longer life, but in health. Therefore, New Zealand should begin to consider ways to sustain their healthcare system for future citizens to ensure there will be funding and care available. Growing population and longevity will have a substantial effect on New Zealand's healthcare system as they work to make healthcare more sustainable. In addition to keeping up with the aging population, New Zealand has to also ensure they are keeping up with the latest technologies to create continuums of care for their patients. Here you can see a graph of 1950 to about 2014 and the life expectancy between men and women. You can see it's been constantly rising, which is why these problems are uprising for New Zealand. So with many countries adopting electronic health records and digital health methods such as remote patient monitoring, it behooves New Zealand to also jump on board with these initiatives as well. In addition, we suggest that New Zealand slightly raise taxes as well in order to keep overall costs low for their citizens in forms such as copayment. We would also implement preventative health initiatives to keep citizens accountable for their health. In order to maintain free healthcare status, we suggest citizens must be enrolled in certain programs depending on their health. For example, if a 65-year-old male was diabetic, he would be enrolled into a remote patient monitoring system for his diabetes to ensure he was checking his blood sugar on a regular basis. He would also be required to have biannual checkups with his general practitioner and see specialists as recommended. These issues are relevant not only to New Zealand, but will apply to most other system models since developed countries will all face citizen longevity and rising costs. Next up, Michelle is going to talk about the second issue.
Our second issue is expensive medication in New Zealand. Medication can take years for one drug to be developed, which is a huge concern on the cost of R&D. Payments for drugs. If the drug is approved, then there's a small copay. A copay for maybe between $5 and $15, and it's free for children under 13. But if it's a non-approved drug, then that's all out of pocket, and that can be an expense that a patient may not be able to take on a day-to-day basis. In 1993, the government established the Pharmaceutical Management Agency of New Zealand, PHARMAC. New Zealand has a single purchaser of pharmaceuticals. This agency decides which pharmaceuticals to publicly be funded, determine the choices that the District Health Board makes on spending when it comes to vaccines, community, and cancer medications. PHARMAC also makes decisions about the medicines funded in the DHB hospitals. Once a drug is approved for sale in New Zealand, drug companies can apply to PHARMAC for it to be government funded. PHARMAC's role are to decide whether the medicine will be subsidized, the price the government is prepared to pay, and the condition of access. PHARMAC is challenged with determining the clinical, economic, and commercial aspects of the proposed medication. Which funds will be saved, what funds are used on spending are all issues that PHARMAC deal with on a daily basis. New Zealanders must pay for other registered medicines themselves that are not on a PHARMAC's pharmaceutical schedule. Medicine adherence is an issue, with a third of all prescriptions not being picked up and only half are taken as prescribed. Is a huge concern. One of the issues to help with this is a new app base called Zoom Pharmacy. This Zoom Pharmacy product requests refills for repeat medications, deliver repeat medication, and it also sends reminders to the patient. It also connects with the patient's doctors to let them know that the patient is taking the medication, has received the medication, and this will offer huge savings on patients who are not taking their medications and also create more education for preventative measures. Factors that PHARMAC have to consider when they get a new request for medications. The need to work out what level is the need and what impact would it have on a disease. The health benefit, to determine what the potential health gain is from this medication, the cost and savings, and lastly, the sustainability. Would this medication be around for years, and would everyone be able to use it the way that it's intended? Are all issues that New Zealand deal with when we address medication. Next, we will have Stephanie, who would propose solution to expensive medication, going ahead of myself. Patient assistance programs. We would love to work with manufacturers to assist with co-pays and out-of-pocket support. Cost sharing. Combining funds with other countries to subsidize the cost of R&D. When other countries work together, this can be done. Next, we will have Stephanie, who will talk about our recommendations and conclusion.
Thank you. We recommend 3 initiatives to lessen the cost burden on the government, which include tax increases or cost sharing between consumers and the government, medication cost sharing between countries, as Michelle mentioned, where countries will share medication development costs, and patient assistance programs where the manufacturer would offer copayment assistance, cost bundling, and rebates for hospitals and clinics who use new products. Overall, the New Zealand's healthcare system is doing well with its current system. However, with an aging population, they could begin to see an increase in costs, which should be addressed prior to becoming a major issue or crisis. Cost sharing is a great alternative to increasing taxes and would lessen the burden on the government without sacrificing coverage and care the consumers are accustomed to receiving. This concludes our presentation of New Zealand. Thank you.